All right, well, I think we're going to go ahead and get started. Thank you for joining me today for the webinar, Know Your Numbers. My name is Amber Mills, and I am a clinical health consultant and registered dietitian with True Health Diagnostics. Today, we are going to discuss Know Your Numbers. It is also called an introduction to your True Health Lab reports. This webinar is mostly to review what the markers mean, and then I'll encourage you at the end and show you a slide to call for an appointment with a clinical health consultant so you can get a more personalized approach based on your specific lab report. So that leads me to, who are the True Health Clinical Health Consultants? Well, we are certified health and wellness experts, offer educational support to patients based on your True Health lab testing at no additional cost for up to 1 year after you've had your blood draw. We provide personalized counseling on nutrition, exercise, drug adherence, and stress reduction. And we are also available for frequent follow-ups. So that way we can help stay in touch with you and help reach your health goals. All right, so let's jump right in with how to read your True Health lab reports. And it's also helpful if you happen to have a copy of your lab report to have that in front of you as we go through the presentation. All right, this is what your lab report should look like. All right, so if you look in the middle of the page, you will notice 3 lines. So these are your new results. And then if you look to your right, if you've had this testing done before, your previous results will have moved over to the right. So that just gives you a nice way to be able to compare the two. You will see the colors green, yellow, and red. Notice that the color represents your risk range. Green are associated with an optimal range. Yellow labs indicate an intermediate risk, and red ranges indicate a high risk. Reference ranges are determined by the national standards and scientific research studies. So this color scheme will continue throughout the lab report to help you quickly identify areas that you are at risk and areas that you're optimal in. Okay, first we will discuss your basic lipid panel. You'll notice that at the top of your test. So you may be familiar with this section of your report, as you have probably had your cholesterol numbers checked in the past. In this section, we are going to look at how much cholesterol you have and the different types of cholesterol. Total cholesterol tells us the total amount of cholesterol circulating in your blood, including your LDL or your bad cholesterol, your HDL or your good cholesterol, and then also your triglycerides. So the goal for your total cholesterol is less than 200. All right, before we talk about each lab value, let's talk about where cholesterol comes from. Cholesterol is produced in the liver, and we consume it in meat and dairy products. If you have high cholesterol, it doesn't mean you need to eliminate these foods. We now know that dietary cholesterol does not impact blood levels of cholesterol, but it is always good to never overconsume any one food group and try to have a balanced plate. Some of you may have good eating habits and still have high cholesterol. Well, high cholesterol can sometimes be inherited. So we'll talk about that a little bit later in the presentation. So in the top section of your test, you will see the value for the LDL-C and the HDL-C. So we like to think of L for lousy and H for healthy. LDLs traffic lipids or fats into the arteries and can contribute to the development of plaque. So your HDLs, the good cholesterol, actually traffic your lipid or fats out of your arteries, and they also help remove them from the blood. So here's a picture of your artery. Triglycerides, they are the main form of fat in your body. They're also known as your energy source, and they are often increased in insulin resistance. If your triglycerides are high, you may also be at risk for coronary artery disease, which can lead to a heart attack or a stroke. You also may be more at risk for diabetes. So the goal for triglycerides is less than 150. Next, we will talk about your lipoprotein particles. So we look at the first box, your total cholesterol, looking at your lipids, and so we want to see if this patient is at risk. Well, that's why we do the advanced testing, so let's go ahead and take a look at the rest of the panel. So just by looking at the traditional panel, we don't have the best idea of being at risk for heart problems or potential heart problems. So let's break these down. First, we're going to start with apolipoprotein B. It is the first one on our advanced panel, and this is a protein that delivers cholesterol to the blood, and elevated levels can lead to plaque buildup that causes heart disease. Next is your LDLP, or your LDL particles. They represent the number of LDL particles that you have. Think of the particles as little cars that travel throughout your body. These cars or particles are filled with your LDL or your bad cholesterol and are responsible for transporting that cholesterol throughout your body. So just as it is risky to drive when there are a lot of cars on the road, it is risky when you have too many of these LDL particles in your body. So the goal is to have a lower number of the particles. Did you know that cholesterol comes in all different sizes? Believe it or not, it is better to have large cholesterol particles than the small ones. Everyone has tiny cracks in their artery walls, so the smaller, dense particles can fit more easily into those cracks, causing a greater risk for plaque buildup and more damage to your artery walls. And so the larger ones can't fit. Therefore, it is better to have large particles. Small particles are commonly present in insulin-resistant patients. ApoA gives a better look at it is a good look at your good cholesterol. So this one actually helps to clear cholesterol from your arteries. So it is the major component of your good cholesterol. HDL-P and HDL-2C. HDL-P is the actual number of good particles. So we have good particles and bad particles. So this number of particles is the cars that are carrying around your good cholesterol. So the higher number, the better. And then we have HDL-2C, which is the workhorse of the HDLs. So it actually cleans the arteries more efficiently than the smaller HDLs. So there again, the more the better. ApoB to ApoA ratio. This just gives us a better look at your ratio of your good to bad. And then the last one on the lipoprotein particles is your LP(ap), or your lipoprotein A. The goal for your LP(a) particles is less than 75. So the elevated lipoprotein a is a risk factor for heart disease and stroke, and it is also genetic, meaning that it tends to run in the family. Our next group of biomarkers is our inflammation and oxidation. Notice they're fibrinogen, hsCRP, and LPPLA2. So we're going to break those down. This is a picture of your artery. Imagine a garden hose cut in half. That is the angle we are looking at. So starting on the left side, you can see there is hardly any plaque buildup in the artery. Moving to the right, plaque buildup increases and inflammation increases. If plaque and inflammation are not controlled, there can be a burst or a rupture, which can lead to a cardiovascular event. So notice now there is a much narrower path for the blood to flow. So we can look more into those inflammation markers. hsCRP, or C-reactive protein, reflects inflammation in your body as well as inflammation in the blood vessels. So levels of this protein can be high when there's inflammation anywhere in the body. So examples of this can include infections, arthritis, allergies, asthma, heart disease, and many more. And then fibrinogen is a protein, and it is involved in the blood's clotting process. So high levels can cause the blood to be too sticky, increasing your risk for blood clots and/or heart events. And then the biomarker LPPLA2, if it's high, it could mean that there's inflammation in your artery walls. So then this could lead to blood vessels rupturing in the area of your heart or your brain. Then galactin-3 measures fibrosis or scarring of the connective tissue, and high levels of this may indicate an increased risk for developing heart failure. And also other potential causes for the galactin-3 to be elevated is increased age, autoimmune disorders, pregnancy, carcinoma. So there's a number of things that can cause the galactin-3 to be elevated. Then our other looking at our stress and function of our heart is our NT-proBNP. This one, if it's elevated, it can just be a warning sign to your doctor that your heart is being overworked and under stress. All right, next group is our genetics testing. So our first one is our apolipoprotein E, or ApoE. It is inherited from your parents. So you'll notice you have two numbers. One is generally from your mom and one from your dad. If you are in the red here, you may be at greater risk for heart disease. Our next genetics group is our platelet genetics. So this marker is looking at your platelet genetics, and this test is really helpful for your physician. It will determine if you are resistant to Plavix, which is also known as an anti-clotting drug. So if you're in the red here, you may not receive the full benefit of the drug's anti-clotting effects because you metabolize it poorly. So that would be something that for your doctor to know. The next is your coagulation genetics. So factor V and prothrombin mutation are both genetics tests to help your doctor determine if you're at a higher risk for forming blood clots. Abnormal clotting almost always occurs in the veins. So they would put you on any kind of prescription for that, or recommend anything to help with that. Next is your MTHFR. So if these are elevated, you may be at high risk for having elevated homocysteine levels. They are directly related with letting homocysteine, an amino acid that we'll talk about in the next group, that they found if it's elevated can lead to heart problems. So it can be directly related to your genetics. So there's two, if you notice, there's two MTHFRs. So the first one is your C677T. This one has been found to be associated with your cardiovascular disease, renal failure, congenital abnormalities, pregnancy outcomes, cancer, dementia, depression. There's quite a list there. For the next one, MTHFR A1298C has been associated with cancer, neural tube defects, male infertility, miscarriages. So this is just a good part of genetics to be aware of and to let your doctor know and see if there was anything that they would have for you to watch out for, and just looking at family history with these genetics that you have. Next is our metabolic biomarkers. All right, elevated, if your elevations in insulin, free fatty acids, glucose, and your hemoglobin A1C may all suggest that you may be having some insulin resistance, some pre-diabetes or diabetes. Your vitamin D test the level that's in your body, and so long-term studies have been linked vitamin D deficiency with a 2-fold increase for a heart attack. So that's a big reason why it's on our test. Uric acid, excess uric acid can accumulate in the body, and it can lead to gout and or kidney disease. TSH, or this is also known as your thyroid stimulating hormone. Thyroid hormones help control the rate at which the body uses energy, so your metabolism. So a high TSH result often means an underactive thyroid gland, also known as hypothyroidism. So there, a low TSH result can indicate an overactive thyroid gland, so also known as hyperthyroidism. And then there's that homocysteine marker that we talked about that was directly related with your MTHFR genetic traits. So your homocysteine is an amino acid found in the blood, and so elevated concentrations can injure your blood vessel walls, cause blood clots, and increase your risk for heart disease and stroke. So a lot of times if you have one of those genetic traits, there may be some kind of a supplementation that your doctor will prescribe for you to help flush this homocysteine level out of your body. The last two on here are your folate and your vitamin B12. So these tests are used to determine deficiencies. So low folate and vitamin B12 may result in also an elevated homocysteine level. So high homocysteine is associated with an increased risk for cardiovascular disease, dementia, and anemia. So once again, if your homocysteine level is elevated, it could be with the genetic traits, and it could be you may be low in one of these areas. So then I would definitely talk to your doctor about supplementation or recommendations. The next group is your renal function, or also known as your kidney function. Cystatin C is a protein that measures how well the kidney is able to filter undesirable waste from the blood. So if elevated, it may suggest abnormal kidney function. Creatinine is a chemical waste product, and it's generated from your muscle metabolism. So elevated levels may indicate a lower GFR, which means your kidneys are less able to excrete waste. The next group is your sterol absorption and synthesis. Sterol testing measures the balance between how much cholesterol your body makes, which is synthesis, and then how much it absorbs from food. Everyone's synthesis and absorption balance is different, so this test helps your doctor guide your treatment. Elevated absorption markers mean your body tends to absorb too much cholesterol from food, so certain medications can help block this. Synthesis markers, if elevated, means your body naturally tends to make too much cholesterol. So in this case, your doctor may prescribe a statin. All right, next is our big diabetes prevention and management panel, also known as our DPMP. So first, you'll usually see the computer-generated page that will give your physician treatment suggestions. All right, then we can look at the numbers on the next page. So all of these markers can indicate your risk for insulin resistance, prediabetes, and diabetes. About 30% of the people in the US with diabetes are undiagnosed. The top box is glycemic control. This is looking at your blood sugar control, what we call short-term, intermediate, and long-term. The middle box is identifying insulin resistance. Insulin resistance is a condition in which your body cannot effectively respond to insulin in the bloodstream. This causes blood glucose levels, also known as your blood sugar, to rise, which over time can lead to diabetes. If red, your cells are not responding to insulin very well, so glucose is staying in your blood. This increases your risk for prediabetes and diabetes. The third box is your beta cell function. Beta cells are insulin-producing cells that are found in your pancreas. Beta cell dysfunction, which occurs when these cells stop working correctly, is a critical stage in the development and progression of diabetes. So if red, the pancreas is stressed out and trying to make extra insulin to get the sugar out of the blood. A few general lifestyle modifications to help improve these values are limiting carbohydrates, especially those simple and processed carbs, while maintaining a moderate fat intake, weight loss if appropriate, and exercise of 150 minutes per week. And that's combining cardiovascular activity with your resistance training. So also remember that you can call and make an appointment with a clinical health consultant that can really help you get a more personalized approach to help with all these values. So a few additional tests is your omega-3 index. This determines whether you are getting enough omega-3 fatty acids. Omega-3 is a polyunsaturated fatty acid, and low levels in the body are associated with risk for coronary artery disease. So if your index is less than 8%, increasing your fish and/or your fish oil supplements can help. However, you should always discuss adding any supplements with your doctor first. Myeloperoxidase, or MPO, could mean that there's inflammation in your artery walls. So this could also lead to your blood vessels rupturing in the area of your heart or brain. And then PSA is your prostate-specific antigen. It's a protein produced in primarily by cells in the prostate. So this test is used to screen and monitor prostate cancer in men. All right, there's a question box there, so let me know if you guys have any questions at this time. Looks like we have one question of what is continine. I apologize. I'm going to have to look into that. I'm not sure what that is. I will look into that and I will get back to you on that one. Someone asked, do we always do all the tests that we went over in the laboratory? No, not all physician offices always run all of the tests. It would depend on your health history, family history. They can feel like they get a good look at your health by what specific tests that your provider has chosen to do. So no, you don't necessarily need to have all of the tests done. And absolutely, this recording will be available probably by Monday, and you can definitely go back and listen to it. As all the other webinars that have ever been done, you can go back and re-listen to those too. So just keep your link and you can click on it, and it should be back up there on the recorded on Monday. You can listen to it then. Someone asked a specific question about being in the hyper category, and it does not always necessarily mean that is related to your diet. I would really encourage you to schedule an appointment with a clinical health consultant so they would be able to look at your full lab results and look at all your biomarkers together and just get a better picture than just looking at the one marker. And yes, I am going to, on the next couple of slides, I'm going to talk about some of our blogs and things like that. And then I will have the number posted for you guys. I can go to that now. So here is, since we want to be a resource for your health related topics, you can follow us on social media. So you can find updates on foods, nutrition, exercise. We're on Twitter, Facebook, Pinterest. And then there's also a link that we put blogs out every single month. So if you want to write that down there in the bottom left corner, the blog.truehealthdiag.com. So yeah, like I said, they're updated monthly. So there's always lots of good information on there. And then here's that information to call and set up an appointment with a clinical health consultant. And I really encourage you to do that. They can look at your lab results specifically and answer any specific questions that you might have and be able to have the full picture. A couple general for reducing your ApoB and LDLP is the exercise and then also reducing your carbohydrate intake. So once again, if you would schedule an appointment, they can really look at your numbers. They'll have you do a diet recall and they can see what your diet looks like and where you can have improvements to be able to help improve all your labs over into that optimal level. Oh, that's a good question. What is the cost for an appointment with a health consultant? If you have had your labs drawn within the last year, it is a free service for you. So you have free appointments that come along with the lab report that you had done. So, and then also the follow-ups are also free. So just we come along with them. So I've had a couple questions about reducing inflammation. Without looking at your specific lab report, a couple things that you can do is generally exercise if you're able. A lot of time those omega-3s can help, so increasing your fish intake. And then also as much as you can cut down on processed foods and having more cleaner intake, more fruits and vegetables and less things from bags and boxes. So also another thing that you can be able to really specialize with your lifestyle and your diet. Oh, someone asked that it's been over a year since our lab and what the cost is now. I apologize. I'm not sure. I know it is based on your insurance. I would call your provider and see if they were still running the lab, and then they would be able to give you a better answer for that. I'm sorry. But yeah, I would definitely encourage getting a hold of your provider. Any other questions? I'll check into the Conitine and I'll send out an email about that one. And I'm not seeing any other questions. So thank you so much for attending today. I hope you have a great rest of your day, and be sure to watch for the recording. And then we have lots of other good upcoming webinars, tackling tobacco, gluten-free foods, the latest in exercise, meal planning made easy, and they're all free webinars. And so watch out for the email for those. Oh, one other question was if your apolipoprotein E was high. If it's in the red, that one was one of our genetics markers. And so it'll always stay in the red because that was your genetics. So just being mindful that it does put you at a little more risk for heart problems. So especially watching your diet and exercise. All right, well, thank you for your time.